Hi, this is Cheyenne. I'm Dr. Bird, and we are going to show you how to help reduce some of the postural issues. Like on a prior video, we talked about Bruder's maneuver. You can check that one out in one of our prior videos. But the forward flexion, the seated postures, all the things of modern civilization and how we work, we tend to bend forward, so we need to offset some of those things. This will help, if you're a patient, you focus on these areas when you're doing what are called trigger points. And these will be the primary spots you'll most likely find to get the maximum results. If you don't have much time, in a few seconds you can work on these areas. So for the neck, you can actually get it yourself. You go up to the collarbone, right into the corner here, and you can work it like this. You can reach it, okay? This muscle group in here, so we're working on the muscles that would be pulled forward and tightened. These muscles in here, you really need an assistant, somebody helping you, or what's called a theracane, which we'll show in a minute. And this is on another video as well on the home care. So, that we have on our home care part of our website. So if we go to the collarbone on the patient and we ask them, we push in right in here, is that sore? So let's see if we can get zoom in right on this. Is that sore? She'll tell you, that's a little tender. So we go in, we find the spot and slowly press in until the person says, deep enough?
Yeah.
And she breathes in and she breathes out, and on the out breath, that feels like it released. Would you agree?
Yes.
So you can take that up a notch, get it to release in a neutral position, then strip it out by stretching the head away and getting it in a deeper spot with the muscle stretched. So that's an advanced way to do it. So right above the collarbone. Many times people will try to go back here because they're sore back here. Really, you need to focus here first. That's your primary. Then up in the base of the skull, and Cheyenne, let's have you turn this way. Then at the base of the skull, you could reach up and in with a knuckle. So right at the hairline, right through here. And you push in until the person says, they're deep enough.
Mm-hmm.
So you'd want them to talk to you as best possible. And I already felt it release. But you want to have the person tell you when it's deep enough, especially if you're not used to feeling the muscle tone change. Okay? So let's go on your back for me. And we're going to show you how to do hip flexors. So the knees are bent, feet are flat on a surface. So this can be done on a couch, on a bed, wherever. So we're going right here where the front of the bone is, right here on the pelvis, wrapping around. These muscle groups attach second lumbar, third, fourth, and fifth across the front of the SI joint or sacroiliac joint onto the hip. They are the core muscles that contract. If you have low back issues at all, get this one. By the way, working here in the neck or working here will affect each other. It's all connected. So we take our hands, we come in like so, we wrap in, so we find the bone, feel it?
Mm-hmm.
We wrap in until the person slowly says,
Yeah.
now breathe in and out. And she'll tell you it feels like we let it pressure.
Yep.
So same concept with this one, to work that area, get it to release, then have the person bring the leg down and back. So you're holding in, they'll drop the leg down nice and slow and let it slide, bring it back up, get it to release that way if you want to do an advanced version, and then let the leg drop off and back, and you're really working that hip. So try that out, make sure you have the person that's working with you breathe. If you have long fingernails, this won't work as well. And for those of you who have something like a theracane here, okay, you can get in and work your own hip flexor by taking this, going like this, go in here. One option is to pull down and in. Then you can hit it yourself, or you can reach here, okay? Another option, turn it sideways like so. Get the knob right in on the hip, pull down, and you can get it to release on your own. So that's how to get the front of the body for those trigger points.